over here.
Should I be in the back?
You're good. You're good. You're good where you are. So Dylan, Jenny's going to show you, and she's going to describe a little bit, not a lot, and then you prompt whatever questions you have. You have 3 students there.
Okay, great.
Okay.
Well, we're in the ultrasound lab, a sonography lab, and we're here with Jenny, one of the current students. So, Jenny, can you just tell us what you're doing here? And
Sure. So I'm scanning on a Phantom right now.
so a phantom, that's
Obviously not a real person. So it's just a model of a fetus. So we can see the facial features over here, the spine, the rib cage, and the skull. And in ultrasound, we usually do a diagnostic sweep. So we sweep out like that and back. Yep, the hand is right there.
So when do you start doing this kind of work? Is it right away?
Yep, so we start scanning on each other, I think, in about the second week of this program, and we're in the lab in the first week as well. So it is a fast-paced program.
We jump right in.
So, as students, would you say it's possible to have a part-time or full-time job while you're working?
I think personally, full-time job wouldn't be something I would recommend because this is a full-time program. I have a part-time job, maybe 10, 15 hours a week. I think it is possible as long as you're able to balance. I think the most important thing would definitely be the commute. If you have a long commute, there's less hours for yourself, so you kind of have to balance that out.
So how much time do you spend at Michener in your first year?
Per week?
Yeah.
Would you say? Ooh. Let's say it's like a 9 to 5.
It's like a 9 to 5.
Yeah, it's like a
It is
9 to
really
5.
like that, yeah. Depending on when you have labs, your schedule might change a little bit, but it's a lot, yeah.
Yeah.
So that gets me to my question about program delivery. How would you say it's delivered to you?
So in terms of,
Like, what's the mix between lab and theory, and how often are you in lectures versus how often are you in the lab?
So there's, we have 5 courses this term, and one of the courses is the actual scanning, so that we have, and then we have the other lab course that we're taking is professional practice, and that one we're sort of simulating how to interact with patients, so that's the other one. And then there are 3 courses where it's more course-based, and we do lectures in those courses, so
It's a good mix.
Yeah, it's a
mix.
very good
It's
balance
very
of
hands-on, I would say.
practical content and what we learn in class, and everything we learn in class is very applicable to what we do in the lab, which is very helpful for us.
Okay, so let's move around.
Which is really cool because you're definitely getting that experience that you might not otherwise have, and I think it gives you a good idea of whether or not you could see yourself doing this outside of school. It's giving you that real life application and the real life experience that you're going to need to figure out, first of all, if you want to do this job, but then how to do it right. The little nuances that maybe we won't be able to accept nurses or sonographers that are actually scanning right now are able to teach us. So I think that that's actually invaluable. The fact that we get to do a clinical placement actually is definitely invaluable and such an addition to our education here.
And that's where you're going to learn.
Yeah, for sure. It's actually doing it.
So for our at-home audience, this is Kyler. She's a student.
Hi.
You were just talking about the clinical placement. What was it? What were the core messages you were just portraying?
Well, one of the things is that I was saying, and I guess the thing that's most unknown about it is that you are able to be placed anywhere in Canada for your clinical placement. So there's a lottery, I believe, that you put your top 3, and they do try to accommodate you. I've heard that normally it's really good and that people are placed kind of around home, so it's easier for them to get in. But that once you start doing that, it's really just invaluable to have that experience inside the hospitals. I think that there's something that actually doing it in the environment that you're going to be working in outside of school, as opposed to scanning scanning in school that really is going to be such an addition to our education and our knowledge of what we're doing. And I think that also working with the hospital staff as opposed to just your other peers and your professors is, again, one of those soft skills that you might not be able to be taught in school and that you're just going to have to experience and learn for yourself. So I think that the way that this program is set up is really amazing, and as a first year, being able to scan on patients within our second week of school is crazy, right? You go through, most of us have gone through 4 years of university that's just theory-based and learning and lectures, writing tests, and now we're actually able to do it. One of the biggest transitions for me, I feel like, was that you go from evaluations that are test-based or, you know, multiple choice exams or a short answer to having practical evaluations where you're actually doing it and being evaluated by your professor while you're scanning. So it adds a different component. It's, you know, some people get test anxiety. I think having performance anxiety is completely normal. And one of the amazing things about that too is that we're actually offered a lot of services here. And resources in order to help us deal with that sort of test anxiety, because this is a really new transition for a lot of people. I've never had practical examinations where I've been judged on my ability to scan or perform a skill before. So I think that having the resources in order to go and get coping skills or mechanisms used in order to help you with your anxiety in order to do these examinations is really amazing.
Yeah, that's awesome.
Yeah.
Wow, thanks, Tyler.
No problem at all. Thanks, guys.
So we're moving to, I think, our last
Would be
station
the best to
here.
answer that question.
We'll go. Let's maybe just sneak right in. Hey there.
Hi.
So what are we doing here?
So I'm doing the obstetrics ultrasound.
Oh, sorry, 1 sec. I'm just gonna.
We got the opportunity to
So this is the OB ultrasound, similar to the first day there, which my colleague Jenny was doing. So we're doing the fetus here. So I'm seeing the fetus with the stomach here, the heart with the 4 chambers. And moving further up, up, up. I can see the face with the nose.
They said to us, all right, you're going to get your lab tools, go and get your scrubs for next
That
week.
shows me the whole fetus.
You're going to be scanning
Wow.
the lab.
That's pretty cool, right?
Yeah, very cool. Alrighty. Let's go talk to Sheena, who is the faculty.
Sites such as, so Calgary comes in and they love our students, so they will actually take some of our students. Excuse me just for a minute.
So Sheena, we just want to talk about at the end of the program, what is there a certification exam?
So in ultrasound, we're newly regulated, so we have to write 2 certification exams. And the credentialing exams are offered by Sonography Canada. So what you want to do within the program is really cool because we've embedded the clinical part of the certification, and then once you graduate, you then it can write the academic exam. So it's it's both that you have to do.
So the practical and the academic.
Correct.
So there's a test and a practical test.
So there is so there's a written exam for credentialing for abdomen, physics, obstetrics, and gynecology. And then there is a clinical exam that's done within the program. So the nice thing is you have to pass that clinical exam in order to pass our program.
Awesome.
Yes.
Well, thanks, Sheena. We're finishing up on ultrasound.
Thank you, everybody. Thanks for visiting.